Prime Minister, there are 60,000 new infections recorded today, partly driven by kids spreading this new strain more readily. Parents want realism. Can you look parents in the eye and tell them that all kids will definitely be back in the classroom before the summer holidays? Sir Patrick Vallance, we've heard quite a lot recently about a second new variant. This is the one from South Africa. Has it reached our shores, and how worried should we be about the South African variant of coronavirus being resistant to the vaccine? And Professor Chris Whitty, how normal can life really be after just the 13.2 million most vulnerable alone have been vaccinated? Isn't the risk for those aged 20 up to 50 too high to let it rip through those age groups?
Well, Sam, I'll take the first one of those excellent questions, just on whether we can be absolutely sure that schools will reopen. Well, I just go back to the answer really I gave to Robert Peston. We think that with the vaccination programme, we can do a huge amount to take out of the path of the virus those who are most vulnerable. That clearly offers opportunities to our country to do things differently, to approach the whole issue of non-pharmaceutical interventions very differently. So I'm full of the same optimism and fundamental hope about the position that I think Chris has adopted, and that I think that things really will be very different by the spring. And that is what I would certainly say to every parent in the land.
So on the question of the variants, as a virus replicates, you get changes in the genetic code as new mutations come in and things change. And those changes in the genetic code then lead to changes sometimes in parts of the protein. And that may lead to shape changes or charge changes on the protein that might mean that the virus becomes recognised differently by the immune system. And that's really the concern that people are looking at. If I take the UK variant, what we know is that those changes, and there were 22 changes in the genetic code, made the virus more transmissible. As far as we can see, it doesn't make it hidden from the immune system. So if you had an infection before, actually the evidence is that you probably neutralise this virus as well, and the expectation is the same would be for a vaccine. With the South African variant, there's another change. That change is theoretically a bit more substantial in terms of the shape, if you like. So it has a bit more of an effect potentially on the shape of the viral protein, which theoretically gives it a bit more risk of not being recognised, but there's nothing again yet to suggest that's the case. So this is being looked at very actively, and it's worth remembering that when a vaccine is given, you don't just make one antibody against one bit, you make lots of antibodies against lots of different bits. And so it's unlikely that all of that would be escaped by any mutation. It's more likely that if there's an effect, it's a sort of minor effect to decrease the binding or decrease the efficacy of the vaccine. But we don't know yet for the South African one. That needs to be looked at. But it's a theoretical risk. And every time we see a variant, that's going to be the question that comes up, and it needs to be looked at. But at the moment, you'd say that the most likely thing is that this wouldn't abolish vaccine effect. It may have some overall effect on efficacy, but we don't know.